each panelist that if you tap the push button on your microphone, you'll see a green light, and then you'll be live, and that'll let folks hear you this morning, which is always important. My name is John Ingen. I have the privilege of serving as the mayor of the city of Missoula, and it's my pleasure to introduce this panel and try to keep things on some sort of even keel, which, given this group, could be extraordinarily difficult. We'll do our best this morning. So our purpose here this morning is to discuss and really thank the folks who have moved forward the carbon pollution standards. That's happening at the federal level through the Environmental Protection Agency. Back in the days when I was in journalism school, there was a turn of phrase that our professors used, and it was called Afghanistanism. It was more appropriate at that time than it is now, but the phrase was all about it's much easier to editorialize about things that are happening somewhere else, things that you don't affect. And the notion that we're considering carbon pollution standards and talking about them in Missoula, despite the fact that this is a national launch, I think is entirely appropriate because growing up in Missoula, I recall being a participant years ago in the first air pollution studies. Those air pollution studies led to the creation of wood stove standards in Missoula. So if you grew up breathing what came out of teepee burners and wood stoves, and you're an asthmatic, you recognize the value of those regulations and that change, which was a big deal and in some ways painful, but today we take it for granted, and we hope that our kids are healthier for it. I hope that someday notions around carbon emissions are things that citizens in general take for granted. Why didn't we do this years ago? It only makes sense. So we're marching down an appropriate path, I think. And thank you all for being here this morning. We have really intelligent people here, so I will stop talking and introduce the panel, and I'll just introduce you as you're preparing to speak. And we will start, ladies and gentlemen, to my immediate left, where Jim Nugent usually sits. You won't be, well, it'll be fine. Dr. Steve Running, ladies and gentlemen, a legend here in Missoula and frankly around the world for his work in the science of climate change. He is a Nobel laureate and University of Montana Regents Professor of Ecology and Director of Numerical Pterodynamics Simulation Group, which is what I was going to do instead of journalism school, but we all pick our path. Dr. Running, welcome and thank you.
Thank you. Well, I think this really is a first step of a very important activity for the U.S. to start putting some real teeth into carbon emission controls. And I think that how important this is by recognizing that the Global Carbon Project puts out the annual worldwide carbon emissions. And they found in 2010 the highest global carbon emissions ever recorded. And so on a planetary basis, we're still losing this battle. And carbon emissions are still going up worldwide. What everyone needs to recognize because of that is that the temperature projections that we wrote into the IPCC 2007 report are at risk of being understated, that the current reality could be higher temperatures than were projected back in our 2007 report. So we really see from direct measurements a situation where the world is spinning out of control in carbon emissions. And we will live to regret that if we don't get on top of this. And I think these steps that the EPA is trying to take this week are the first critical steps for America trying to do exactly that. Thank you.
Thank you, sir. And next, a pediatric pulmonologist who has some experience with kids and lungs from Community Medical Center, Dr. Paul Smith. Dr. Smith.
And I'd like to thank the organizers for letting me have a little bit of time to speak about this morning. I always find it interesting when I'm listening to talk shows or reading editorials about some of the criticisms for Clean Air Act and the EPA's efforts, that the one subject they never talk about are the healthcare costs. And I think that's because that's one argument they know they're going to lose. There really is absolutely no doubt that these effects are really hurting both us as adults and our children in terms of lung health and other diseases in a major way. At the tune of some $500 billion a year estimated from coal burning plants alone in terms of just the healthcare costs. And just to give you a couple of examples, I know that for the most part the rules are talking about carbon dioxide emissions and carbon footprints, but it also will help reduce the emission of gases such as sulfur dioxide, ozone, carbon monoxide, and heavy metals. And for children especially, a disease like asthma is not a disease that goes away when you then provide clean air. It's not just a dirty thing that smells bad. Asthma is an accumulating disease that causes scar tissue in the lungs. And none of our treatments right now really treat the scar tissue. We know of nothing that's going to make this go away. We're in the middle of an asthma epidemic, and so the more that we expose our children and our adults to these gases, the more we're creating a new population of children that are going to suffer for decades. Children drink more water per pound of body weight, they breathe more air per pound of body weight than adults, and they're going to be doing this for decades. And so the things that we do now are going to result in either improved or deteriorating lung conditions for decades. And they just won't talk about the healthcare costs, they won't talk about the lives lost, and yet it's estimated over 20,000 lives a year are lost because of emissions in coal burning plants. Another area of great concern to me is the increased rates of newborn lung disease. We know that prematurity goes up. We know that infants are born smaller when their mothers are exposed to pollution. We know that when the mothers are exposed to air pollution, they collect mercury that then settles in the bloodstream of infants and causes learning disabilities, birth defects, and neurologic disorders. So I think, our concept of, well, we're just trying to clean up the air really falls short if we're not taking into account the things that we're doing for our children. Right now, there really is no estimate of what this is going to mean for decades to come in terms of the monies and the lives that we're going to lose simply to support people that are affected by emissions. And so it's an important area that I think that we have to continue to fight for. I can't imagine that the efforts to take the teeth out of these laws are going to stop just because they've been rolled out. And so I think anybody that has an interest in children, anybody that has an interest in their inalienable right to clean air, and anybody that cares about the economics of the healthcare costs that we're going to have for decades, really needs to help continuing the support of laws like this. So I really appreciate the efforts of the Missoula City Council in collecting people like this to lend a voice to it, and appreciate the chance to give my voice to it too.
Thank you, Dr. Smith. Appreciate that. We also have today one of Missoula's best holistic thinkers and viewers in the form of Beth Shank. Beth slaves away at St. Patrick Hospital and Health Science Center. And she is, as a nurse, she's spent a portion of her career fixing folks who are broken, but recognizes the incredible value of keeping them from being broken in the first place. And her notions around prevention and her efforts around prevention in environmental health are pretty remarkable. Beth.
Thank you, Mayor Engen. And thank you all for pulling this panel together. And thank you to the EPA for addressing this issue with a little bit of teeth, though I'm hoping those teeth will get sharper. It is a historic time. As we have learned today, it's the 5th anniversary of the first time that the EPA had the opportunity to address greenhouse gases. And we're grateful for that. We, as Dr. Smith identified, there are a number of health effects that come just from greenhouse gases, including respiratory, cardiac. We're facing more with fires, with agricultural loss. So the impacts of not addressing this to both our economy and our health is tremendous. Also, I want to follow up a little bit on the issues of pollutants from power plants in general. because those two continue to exist and continue to be important, as also Dr. Smith explained, sulfur dioxide, mercury, and others, and these affect asthma, respiratory disease, heart disease, and numerous cancers. So it's very important that we do what we can to protect and prevent, and from a nursing perspective, we're interested primarily in protecting public health, avoiding the problems in the first place, as the mayor says, in promoting health, protecting that on which we are dependent, which is certainly clean air, arable soil, clean water, and also helping people in their communities understand the risks and exposures they each have. We don't have power plants right here in Missoula Valley. What we do when we turn on the switch affects downwind of the power plants that we get our energy from, and it affects our local situation. Thus, we all need to understand it. It impacts all of us. So this can be increased through education, community events, and outreach. Along those lines, one more thing I'd just like to say is a lot of times people, all of us, people in the communities, wonder what we can really do and wonder how we're so dependent on energy. Can you imagine what we would not be able to do if we did not have steady energy? We really, really need that, especially the more electronically dependent we are. Nonetheless, as mentioned, every time we turn on a switch, about 60% of our energy here in Missoula comes from coal and about 40% comes from hydro. And so what is the connection? When I turn on the switch, what's happening basically in the coal world? That's a difficult metric to know. We can't know exactly, but we can know that something is happening. So therefore, two directions that I would like to mention that we can go. One is this one, regulatory, continuing to say, what is an acceptable level of pollutant that we can live with? And is there one? But practically speaking, just to bring those lower. And then the second is really in our own conservation, so to do what we can to impact our use. So when we're turning on a switch, we know more about what's happening and we are minimizing our own impacts. I think that's what I have to say. Thanks so much.
Thank you very much, Beth. Bill Gear is a sportsman and climate change initiative manager, and I love this, for the Theodore Roosevelt Conservation Partnership, which gives me occasion this morning to say, bully.
I'm a fish and wildlife guy, and I look at animals and fish that do not get to vote in the public square on whether or not they believe in global climate change or whether or not we should, do things with greenhouse gas emissions. Animals vote by adapting to migrating or dying, and they look at it every day, and they integrate all the information on carbon and temperature changes and water changes and how they live on a day-to-day basis. And there was a famous wildlife scientist back in 1981, he told the Environmental Protection Agency that the condition and diversity of fish and wildlife populations is a litmus test of a healthy human environment, and I believe that's true. And I believe that hunting and fishing, which is the ultimate outcome of what I do in fish and wildlife, are the dividends we receive for doing things right on the land and in the water. And doing the right thing now is mitigating greenhouse gases and carbon pollution. And when it comes to fish and wildlife, I don't have to debate whether or not something's going to happen 50 years from now, or we see changes 100 years from now, because we're seeing the effects right now. Here's just a few examples. If you look right here in Montana, if you look at what's happening in terms of temperature, we're saying that the Yellowstone River is warming up. If you look at the Yellowstone River in Livingston for the last 50 years, both the June runoff and the August stream flows are going down. They've gone down substantially, perhaps as much as 25%. And if you're a Yellowstone River cutthroat trout, that means quite a lot. And what it means is smallmouth bass, because of rising river temperatures, have moved upstream in the Yellowstone cutthroat water over 40 miles, all the way up to Reed Point. They have viable reproducing populations. And so someone might say, so what? I like smallmouth bass. But remember, the temperature is changing. It's smallmouth bass now, what comes next. And if you look at other things, at the high elevation, look at white-tailed ptarmigan and birds. The tree line is going up because of rising temperature. And that's when they're running out of physical habitat. They're not a bird that can migrate and go somewhere else. They have to stay on the top of the mountain. The alpine zone habitat is disappearing. But not only that, the warming temperature in warmer springs is causing their breeding to move up an average of 12 days, which is reducing their reproductive success. And that means fewer birds survive. And if you're a hunter, you don't get to hunt as many white-tailed ptarmigan. And I'm a hunter and fisherman, and that's pretty important to me, but it's also important economically because in Montana, hunting and fishing is the basis of $1 billion a year outdoor recreation economy. $1 billion a year, that's as much as an energy industry in the state, but it's sustainable if we do things right on the ground.